This film will show you which exercises will help you to prepare for and recover from a knee replacement at the RUH. Your joint relies on the muscles around it to move and perform your daily exercises efficiently. Exercises that encourage your joint and the muscles around it to work well can significantly aid your recovery and maximise the long-term benefits of your joint replacement surgery. The exercises presented in this film should be practiced prior to surgery, allowing you to familiarise yourself with them and to prepare for your joint surgery as well as possible. You can use them straight after surgery, guided by your physiotherapist on the ward. The initial exercises for you following surgery are primarily aimed at improving circulation to reduce the chance of blood clots and reduce stiffness in the new joint, which often leads to less pain. Initially after surgery, these exercises should be started with low repetitions, about 3 to 5 at a time, but repeated regularly, approximately every hour. At home, before your surgery, you should also start with low repetitions, about 3 to 5, but you can perform them 2 to 3 times a day. Ankle pumps. Sitting in bed or on a chair, paddle your feet up and down, bending at the ankles. Static quads contractions. Sitting in bed, your leg relaxed out straight, contract the muscle on the top of your thigh, called your quadriceps muscle. It is important to isolate the muscle contraction, so the muscles around your hip and the back of your thigh should remain nice and relaxed. When your quads contract effectively, you'll see your kneecap being gently pulled up your leg and your knee going straighter and flatter to the bed. Static gluteal contractions. Sitting in bed or in a chair, squeeze your bottom muscles. It should feel like your body is being lifted. Hold for a couple of seconds and then relax fully. Knee bending in bed. Sitting in bed, gently bend the knee as comfort allows, keeping your foot on the bed, and then relax the knee back onto the bed. If over several days they are comfortable to do and are not irritating your joint or any other part of your body, then you can slowly increase the number of repetitions by about 1 or 2 for each exercise. After surgery, it is essential to get your knee bending as far as possible in the first few days and to continue to challenge it regularly to maximise this movement for the long term. This is best achieved sat in a chair or over the edge of the bed. Slide your foot back while keeping your foot still on the floor. Slide your bottom forward in the chair into discomfort. There are some techniques which should help to reduce the discomfort. Things like deep breathing, foot tapping, rocking your body from side to side. As the discomfort settles, slide your bottom forwards a bit further into discomfort again and repeat the relaxation techniques. You are aiming to achieve a 90-degree knee bend. Inner range quads. Sitting in bed, place a rolled up towel underneath your knee. Straighten your knee, keeping your thigh on the towel throughout and seeing your heel raise. Knee extension. Sit in a chair. Slowly straighten your knee, keeping your thigh in contact with the chair. Focus on getting your knee straight rather than trying to lift your leg very high. Then slowly lower. Side lying leg lifts. Lying on your side in bed, contract your bottom muscles and then lift your leg level with your hip and then lower. Armchair push-ups. Sitting in an armchair, place your hands on the armrests and then push down through your hands to lift your bottom off the seat, keeping your feet on the floor. Then lower your bottom back onto the seat. It can be difficult to move around the bed and stand up from sitting with a joint replacement. Therefore, if we can strengthen your arms, this can make these activities easier for you. You have just had major joint surgery. All the muscles and soft tissues around your new joint have been stretched and will tire quickly post-operatively. The key to recovery is to get the new joint moving immediately, but only doing small amounts in one go. Little and often is the mantra. Exercise, walking, and normal activities of daily living are challenging to the new joint, and should be increased gradually as comfort allows. It is normal for your leg to be swollen and to experience some pain. This is helped by regularly using painkillers, using ice, and by moving the joint regularly. Please refer to the exercise summary sheet in your hip or knee replacement patient handbook. We hope you have found this video helpful. Contact your physio team if you have any questions.